Alzheimer's affects 1.1 million Canadians, and January is Alzheimer's Awareness Month. We're joined by Stephanie Erickson, family caregiving expert. Thank you so much for being here.
Thanks for having me.
So let's talk about, first of all, why it's so important to have an Awareness Month, why it's so important to talk about Alzheimer's.
Well, there's a lot of stigma associated with it, and I think what happens with stigma is that people then avoid getting care. They avoid getting treatment because they're embarrassed, they're ashamed, they feel isolated, and the more we talk about it, the more it normalizes it. I think it's better just for the community, it's better for individuals and for family members, and hopefully it will help people get early treatment.
And we hear a lot about dementia and Alzheimer's. Can you explain what's the difference between the two?
Yeah, a lot of people think it's one and the same. But dementia is really about a group of symptoms, and there's a lot of causes of those symptoms. Okay. Alzheimer's disease is the most common cause of dementia, but there's lots of causes of dementia. Vascular, Korsakoff's, Lewy body, there's lots of causes of dementia, so they're actually not the same thing. A lot of people connect them together, but it's not the same thing.
Okay, good to know.
Yeah.
Now, what are some of the things that perhaps people should look out for if they think that maybe a loved one, someone close to them, might be suffering from Alzheimer's?
Well, usually the first thing that I hear people say is short-term memory loss. That's the first thing that usually comes up, but there's lots of different symptoms. So, of course, memory is one, short and long-term. We've got confusion, so things like not understanding how to use a remote control, not sure how to use the phone, difficulty managing banking, getting lost somewhere, not recognizing a person, although that's usually in the later stages, language problems, so difficulty finding words, and things related to executive functioning, which would be judgment and decision-making, problem-solving, so things like, I can't make this recipe anymore, I can't follow along with the steps.
And what do you suggest if someone is starting to maybe pick up on some of these things? What's the first thing they should do?
Go see their doctor. Go see their doctor, but people are scared because as soon as you go, oh, I can't remember that word. I mean, even myself in the field, if I'm like, oh, what's that word again? I'm like, oh no, what does this mean? Yeah. But a lot of the causes of memory loss can be related to other things. It could be thyroid problems, depression even. So it's important to go see a physician to have an evaluation to figure out if these symptoms are even related to a type of dementia, or maybe it's related to another medical problem.
And if the family members are noticing, is it a good idea to bring this up? Because as you're saying, you know, it's a scary thing. There are still some stigma, so it can be something difficult to talk about also. It's
very difficult, but people have to talk about it. And yes, I think you should bring it up to somebody. I'm one who always likes to be honest, so I don't like it. If people were to like trick me into going to the doctor, I wouldn't appreciate that. And I think that then that creates conflict within the family for a longer period of time. So I think it's important to address it directly with your loved one. I'm concerned about these things. Let's go to the doctor. Let's have an evaluation. But I have to say a lot of people resist going to the doctor. They don't want to be given that diagnosis, and so people wait and wait and wait. But if they go earlier, there are some medications that can help to just prolong the progression of. It doesn't take it away, but at least it can alleviate some of the symptoms for a while. So early intervention is very important.
So, yeah, very important, that early diagnostic.
Yeah.
Let's talk about the impacts on the family. My grandmother had Alzheimer's, and I lived it firsthand. It's terribly difficult on loved ones. And for different facets, right?
Yeah, I mean, of course, there's the financial strain because you're having to bring care and support into the home, or sometimes even supplementing or paying for care outside of the home. But then there's the emotional and psychological impact. There's the physical fatigue. It's non-stop, 24 hours a day. Yeah, and sometimes a person oftentimes has difficulty sleeping, so then it's interrupting our sleep cycle, which makes us more exhausted, more prone ourselves to medical problems. And it's isolating as well, because sometimes friends and family start to distance themselves from the person that has the disease, therefore their main caregiver as well, so it becomes more and more isolating.
And just real quick, we don't have much time, but there is support also for families, right?
Yeah, I mean, I recommend you go to the Alzheimer's Society here in Montreal, or the Alzheimer's group here in Montreal. Certainly the CLSC has some social workers that can assist as well.
All right, Stephanie, thank you so much.
My pleasure.
Such an important thing to talk about, and affects many Canadians. Thank you.
You're welcome.
Stay with us. We are going to have a full look at weather and what's making headlines coming up next.